One tool in the fight against ticks and the diseases they carry, like Lyme, is back online. It's the Upstate Tick Testing Program. It's up and running again. Joining us now to talk about it is Dr. Saravanan Thangamani, who, among other things, runs this program. Thanks for joining us, sir. Appreciate it.
Thanks for having me.
So I've talked recently with our friends, Dr. Thomas, Dr. Katie Anderson, the County Health Commissioner. They seem quite concerned still with the tick problem in this area, specifically the diseases they carry. What's your level of concern and why?
Well, I think I echo their concerns. It is very clear from our tick surveillance program that we are doing since 2019 is ticks are continuing to emerge in new geographic areas, new counties. Along with them, they also bring new tick-borne diseases to that county. So it continues to be a major public health concern in my eyes, in Dr. Thomas and Dr. Anderson eyes as well.
So the tick testing program, as we said off the top, it is back. It's not free anymore. Why would you suggest people utilize this service?
Well, I think when someone finds a tick, it is important to know the risk of getting the tick bite. If the tick is tested to carry a particular infectious disease agent, for example, the Lyme disease agent, at least it gives an additional layer of a risk assessment for that tick submitter or the clinical provider that the human who got tick bite is now at a higher risk of getting a Lyme disease. So testing the tick is very important to know if a person will have a higher risk of acquiring a disease or not. So it's very important. Someone gets a tick bite, they need to check it out.
How many ticks are you starting to see already as we get outside more and more, and now the lab's up and going full speed? And what are you finding in them? Because as we've talked, it's not just Lyme anymore, really.
So since our testing began in 2019, actually, we tested about 33,000 ticks. Ooh. And we had a pause for a year because we couldn't get funding for free tick testing. And we reopened the tick testing program with a fee on April 4th of this year. And barely, we are 4 weeks into the program. We got about 200 plus ticks coming into the lab with paid tick testing fees for that.
What is the?
And I must
go ahead.
Sorry to interfere. So I forgot to answer the second part of the question. So 1/3 of the tick that are received in the lab carry at least one tick-borne disease-causing agent. Amongst them, the Lyme disease agent is the one that we see in almost 33% of the ticks.
What is, I mean, let's just kind of cover this. What is the cost? Because I know Onondaga County, through the health commissioner, Dr. Anderson, she's able to kind of offset some of that cost. So what are we talking here in Onondaga County? What are we talking about for people in other surrounding counties?
Agreed. Together with a collaborative agreement with the Onondaga County and with Dr. Anderson, we are able to offset some of the operational costs for the Onondaga County residents. So for the county residents, it is $37. And for non-county residents, it's $75 per tick.
Okay.
And we are now testing ticks throughout the United States.
Oh, okay, okay. So how do you do it? Do you just put it in a little baggie in an envelope, mail it off? Like, what's the best way to get that tick to you as soon as you pull it off the proper way?
The instructions for how to submit a tick and how to send a tick are in our website, www.nyticks.org. So when someone finds a tick, they just pull the tick and put it in a Ziploc bag. And then they go to our website, provide some information. We then give a unique tick ID, and then they scribe the unique tick ID on the envelope, pay the tick testing fee, and then they ship it to the lab. Once the tick is received in the lab, we surface sterilize the tick, we grind the tick, and then we look for 16 different tick-borne pathogens in the tick. And then as soon as we detect them, we send the results back to the submitter. Our turnaround time is now about 3 business days. So we are able to send the results within 3 business days.
Got time for sneak one more in. You've talked how it will benefit the person who sends the tick in. What does the lab get out of it? What's it offer you to find out what these ticks are carrying?
So we continue to monitor the emergence of tick and tick-borne diseases in New York State. Unfortunately, because we are now charging, we may not be getting the same number of ticks we received earlier, but we are hopeful that with the data, with the ticks that are coming in, we will still be able to help the counties and health departments and educate them on the emergence of tick and tick-borne diseases in each county.
Great. Dr. Thangamani, thank you so much for your time. We really appreciate it. Very informative, and we'll have to have you back again. Thank you, sir.
Thank you.